the history of it's absolutely incredible, right? Two brothers that were touched by a family, an event that happened to a family member, and just sort of committed themselves to saying, we have got to make things better. We've got to make things better for the millions of people who walk through clinics and hospital wards every day. And I think what's so empowering about it is the ability to bring data, vital signs and lab results and nursing notes and other elements and other parameters into a singular composite score that can give the clinician not just a snapshot of what's happening to this patient, but to actually give them a longitudinal trend and give them kind of a longer view to say, where are we heading? Are we moving in the right direction? Are we going in the wrong direction? Do we have to rethink a care plan? Do we have to rethink one of our strategies?
The News and the Muse, the other early warning scores out there, they wait till your heart rate, your blood pressure, your respiratory rate, and your SAT have done something. When you could have really seen when someone started to kind of hang back and not have that appetite and not be doing the activity that they normally do. And that's what nurses pick up.
By the time a patient's vital signs change, you can be in a lot of trouble.
By it linking the vital signs and the lab values and the nursing assessment data in a unique way, it takes that EMR data and provides it to the clinician in a way that is hopefully helpful to them to understand that patient's condition.
The combination of the new SWAT nurses and their use of the Rothman index was what helped drive down mortality.
We use the Rothman almost as a report, if you will, in the morning and at the beginning of the night shift as well. And we would peruse the Rothman indexes by floor. We would know which floor we would round on first and inquire on specific patients based on what we were seeing, trends, declines, or even just a low Rothman. And over time, we were pleasantly surprised that the data bared out over several months that with that key introduction of the SWAT team using the Rothman, that we had a decrease in mortality.
Literally looking at the Rothman in real time, seeing the Rothman fall, going in and actually assessing the patient with the rest of the nursing staff and seeing, number one, the patient didn't seem acutely ill, but within a very short period of time became ill. And that there was an opportunity for an interdiction.
It's something that's now a reflex, just like you go in and want to take a look at the vital signs and the medications and any notes, progress notes or consultants left. You want to look at the Rothman score and say, where are we today? What do we need to do and where are we heading and how are we going to get there?
My SWAT nurses will tell you the Rothman doesn't lie, so you can't ignore it.